Thank you, thank you. Hi, everyone. I am so happy to be with you this afternoon. And I too am excited to do a lab. It has been many years. Oh, and Dr. Thomas is with us today too, my colleague. Hey there, Dr. Thomas. So I'm so thrilled to be with you all, budding scientists and physicians and other health professionals. Today we are going to talk about a really, really interesting case, and I'm so excited because it has all these implications for you as young people, and it's totally relevant to what's going on now in the world. Before we dive in, I just want to introduce myself a little bit more. I'm Kristen Kahn. I am coming to you from my clinical office in Seattle at Capitol Hill at Kaiser Permanente, where I'm a family physician. And I see people in the office, all ages, from newborns all the way up to 100-plus-year-olds. I do not do what Dr. Thomas does, which is I don't take care of people in the hospital, just folks who are coming into the clinic. And I do a lot of my work this way because of the pandemic. So doing a lot of medicine by Zoom or what we call telehealth, which is a whole new challenge. But I love it, and I am so thrilled to be sharing some of what we do in the office each day with you today. If you have any questions along the way about anything, like Amanda said, put it in the chat. And we'll also save a little bit of time at the end for additional questions and conversation. All right, so I think we've got most of our participants here. So I think we'll just go ahead and get started. Hopefully everybody got the case, the disease detective case. So I'm going to start exactly, it's fascinating. I'm going to start with this case. What is wrong with Mike? Okay, so here's what they tell us. And this is pretty typical of what you might learn if you were talking to someone in the office or if a parent called. So yesterday, Mike Wright developed a severe headache, a high fever, and a stiff neck. Then he became nauseated and began vomiting. He just wanted medicine to make him feel better and a dark, quiet room so that he could sleep. Today, Mike's parents noticed that he was so sleepy that it was difficult to get him to wake up, and he seemed confused. So they took Mike to the emergency room because they were worried that he is very sick. Okay, now I'd be worried too. If Mike was my son, I'd be very worried. That's not normal sickness, right? That's not common cold type of sickness. So we now can go through Mike's symptoms and track them on this graph. So does everybody have their paper and their graph in front? Now, part of the reason we're doing this is in medicine, we really try to be methodical and analytic. So we listen to the person's history, what we call the history, which is the story of their illness. We take an accounting of all the symptoms and we put it in a framework. And we think about how that framework matches with what we know to be the presentation for other illnesses, right? So you know that if you have a runny nose and you're sneezing and your eyes are itching, it's probably allergies. Those are three things you know about, right? So we're going to do the same for this illness. Okay, so Mike's symptoms. Fever? Yes. Headache? Yes. Cough? No. Stiff neck? Yes. Nausea and vomiting? Yes. Light sensitivity? Well, yes, he had to go into the dark room, right? Muscle aches? No. Confusion? Yes. Okay, so we've got the list of Mike's symptoms. All right, so now let's look at the next few categories. Now, these next four categories are ones that they have presented to us, but I want to add a fifth. And I want to add a fifth that is particularly relevant now. So I want you to go to the chat and see if you can think of an illness that's circulating now that we would have to have in mind as we think about Mike and his illness. Can you think of what that illness is? And if you can, just put your idea in the chat. All right.
We can also have people unmute if they'd like. We have fewer people than I thought that there would be, but plenty of people.
Yeah, if anybody wants to come off mute, please go ahead and do it. Otherwise, put in the chat what is circulating these days that you might be really familiar with. COVID. Yeah, COVID-19, absolutely. Good detectives. You are looking at the current context and thinking about what's going around. And COVID is still on the rise, and especially among young adults. Okay, so we're going to think about that as we look at Mike too. All right, so let's go through the COVID symptoms. All right, fever with COVID? Yes. Headache with COVID? Yes. How about cough? Yes. Stiff neck with COVID? Not so much. Nausea, vomiting? Yeah. Light sensitivity? Plus or minus. Muscle aches? Oh yeah. Confusion? Well, maybe in those who are hospitalized, but probably not in most who aren't. So, so some of his symptoms match with COVID-19. So that's something we'd have to keep in mind. Lucky for us, we know that this was not put together, it wasn't written during the COVID era. So Mike doesn't have COVID, but he could if we were thinking about it in today's context. All right, so let's look at viral meningitis. You got your checklist in front of you? All right, viral meningitis, fever, yes. Headache, yes. Stiff neck, yes. Nausea, vomiting, yes. Light sensitivity and confusion, yes. No to muscle aches and cough. And did you get that information from the description? So on the last page of your packet, there are 4 possible diseases: viral meningitis, bacterial meningitis, influenza, and West Nile encephalitis. All right, back to the chat for a quick second. Who's heard of West Nile encephalitis? Can you just put a yes in the chat if you've heard of that? And I'm not going to call on you. I'm just curious. Who's heard of it? Okay. All right. So there are some people who have heard of it. Well, I think, what was it? Maybe about 12, 15 years ago, maybe a little more than that, that West Nile virus became a thing. And it was a scary thing when it became a thing. And it was really scary because it was spread by birds. And so many of you were just born, you were toddlers, you were really young when West Nile virus became a thing. And interestingly, what's happened over your lifetime, this is over your lifetime, is it's faded into the background. So it's no longer the thing that is scary. It's now a thing that is just a part of life. So it's really interesting how that happens. And it may be that COVID-19 becomes that too, right? It just becomes another thing that is background and we know how to handle. That's what Dr. Thomas and I are hoping, that it fades into the background and we manage it the way we do the others. Okay, so thank you for those who responded, yeah. All right, let's look at the next ones. Bacterial meningitis. So if you take a look at that list of symptoms, are there any on there that seem, they're not a part of bacterial meningitis? And you can throw that in the chat too. Of all the symptoms listed there, what doesn't seem to be a part of bacterial meningitis? Okay. Okay. Light sensitivity. Thank you, Audrey. Others? Okay. And how about cough? Is cough a part of bacterial meningitis? Do you see that listed? It's probably one of the ones that people are less likely to have. And muscle aches, maybe a little less so. And that comes directly from that last sheet in your book. But we can see bacterial meningitis has fever, headache, stiff neck, vomiting, nausea, light sensitivity, and confusion. And this is an illness that is no joke. All right, let's talk a little bit about bacterial meningitis for a second. So bacterial meningitis is very serious illness. And like so many illnesses, there are vaccines that can help to prevent this condition. And as a baby, many of you probably received a vaccine to prevent a certain kind of bacterial meningitis. And as teenagers, you get another one to prevent meningitis. So this is one of those conditions that is treatable or preventable with vaccines and treatable when caught early. Okay, but it is no joke. So has anyone experienced or know of anyone who's had bacterial meningitis and been hospitalized? No one? Okay. It can be very devastating. And as part of my training way back when in pediatrics, we see a lot of kids with fever who might have bacterial meningitis, and we're going to talk about how we evaluate for that. Okay, let's move on to flu. I'm sure many of you have had the flu. The flu feels terrible, right? You got fever, headache, cough, but you don't have a stiff neck with the flu. You might vomit, feel nauseous. You might have muscle aches, but you're not going to have the light sensitivity, and you shouldn't have confusion with the flu. And then lastly, West Nile virus. Same thing, fever, we talked about headache, nausea, vomiting, muscle aches, maybe not so much confusion. I once took care of a gentleman in the hospital. This literally was 15 years ago, longer, who was in the hospital for like almost a week. This is back in the day where you could keep someone in the hospital for a week with West Nile virus. He was just couldn't do much of anything. He was stable, but he really couldn't attend to himself. So all of these conditions can land people in the hospital, all of them, right? But the bacterial meningitis, that's the one that we have to be really careful. Hey, Dr. Thomas, thank you. You wrote, I had a deaf patient last weekend. Do you want to come off mute and tell us about that?
Yeah, she was my first patient in a while where we had to use a sign interpreter on the video sign interpreter, and she had been deaf her whole life that she could remember because of bacterial meningitis, causing swelling in her brain and then impinging on her the nerves that go to her hearing. So it was sad that we see a lot of that. We see a lot of that, but we see it sometimes.
Yeah, we do. Thank you so much. So let's talk a little bit about what meningitis is. And Dr. Thomas just shared with us that meningitis is the swelling or irritation of the lining around the spinal cord, and it can include the brain as well. So you can imagine if you've got swelling and inflammation around your spinal cord, your brain, how painful that would be, and how that would really be a hard infection for your body to fight. So why do you think it's important that if someone has an illness like meningitis, that we catch it and diagnose it? Any idea why that would be so important? Well, one is our job as doctors is to treat people, right? So we definitely want to be able to figure out what's going on with Mike and help him feel better, because we don't want him to suffer those consequences like deafness. The other thing is, what do we know about COVID-19? Is it contagious? Can you pass it? Absolutely. And so with these different illnesses, they're all really contagious. So making that diagnosis is critical, because then we can do things to prevent the spread. So we went through the chart, we looked at all the symptoms. It's time to vote. Okay, everybody go to the chat. Based on his symptoms and the 4 other choices here, what do you think Mike has? And you can just put your ideas in the chat. Bacterial meningitis. Okay, what else? Anybody have another idea? Thank you, Sophia, for getting us started. Any other ideas? Does anybody want to put in, okay, meningitis? It can't be COVID. All right, I think bacterial meningitis, people are narrowing in on that. Does anybody think it could be flu, influenza? I don't see any votes for influenza. Any other ideas? All right, you guys are brilliant. You narrowed in on this. I sense there are a lot of future doctors and health professionals in this group. So very good. Thank you for putting your thoughts in there. Okay, so definitely seems like meningitis. The question we need to answer is, well, what kind is it? Is it a viral or is it a bacterial meningitis? Why is it important to know? The treatment's totally different, completely different. And the last thing we want to do is give someone the wrong treatment. Ooh, Daniela says, I actually like doing diagnosis. Me too. You know, you get to use your brain, you get to do all this testing. It's a lot of fun. Okay, so how will we know if it's meningitis? Well, so partly we listen to the story and put together a pattern around the symptoms. The next thing is we examine the patient. And this case tells us that there is a maneuver. There are 2 maneuvers we can do to elicit some symptoms if a person has meningitis. Did anybody see that first one about the neck? So if you have the person lying down and then you carefully have them raise their head, they will reflexively bend their knees. Reflexively, they will feel almost no, they have to do it for sort of comfort. Reflexively, they just will bend their knees. So that's one that's very interesting. The other, this is a little bit harder because so many of us have tight hamstring muscles and tight leg muscles already. But another is if a person's lying down flat and you raise the leg, they're unable to raise it straight. Instead, it comes up very bent. Again, all of this is because with the straight leg or the flexed neck, it really puts a lot of tension on the meninges, the lining around the spinal cord and the brain. Very painful and uncomfortable. Okay. The other things you might see are, you know, fever, right? So as you examine Mike, you might notice he has a really high fever. The other thing that that you might notice is that, again, his eyes are shut. He's really trying to block out the light. So there might be some things you observe, and there might be some things absent. He might not have a runny nose or complain of a cough. His lungs are going to sound clear, right? So these are the kinds of things that are not there that help you zero in on the diagnosis too. So thank you. All right, shall we go on? So what is meningitis? We just talked, it's an inflammation of the meninges. The meninges are the tissues that surround the brain and the spinal cord. And inflammation just means redness and swelling, irritation. You know how you get a stuffy nose and your nose feels congested and stuffy and inflamed, it's hard to breathe through it? Well, imagine that same kind of thing happening around the brain and around the spinal cord. That sounds awful, doesn't it? Really painful. So once we've decided that Mike has meningitis, we have to do some further testing. And one of the tests we're going to do is to take a sample from around his spinal cord so that the spinal cord is bathed in a fluid called CSF, cerebrospinal fluid, CSF. So we're going to talk about how to take that out and test it. Again, we got to know what's causing it, because otherwise we can't treat Mike. And if we don't treat him, we might also be putting other people at risk. So we're going to do this procedure called lumbar puncture. There's another name for that procedure too. Has anybody heard the other name for a lumbar puncture? It's called a spinal tap. Have you heard that word, spinal tap? And it literally means tapping into the spine and taking out a little bit of fluid. And as learners, as health professional learners, it's one of the scariest procedures to do for the first time, the second time, the third time. But you know what? Once you've done it a few times, it's actually a quite a satisfying procedure, because it really helps you find the answer so that you can save people's lives, quite literally. So I want to dissect those two words though, lumbar puncture. So lumbar is a part of the spine. Does anybody know what part of the spine that is? Upper, lower? Where do you think it is? Okay, who thinks it's the upper part of the spine? Just go in the chat and write upper. Who thinks it's, okay, great. I love these folks committing, awesome. Who thinks it's the lower part of the spine? Go in and put lower. You guys are great. Okay, so let me tell you the components of the spine. So the neck is called the cervical spine. So that's the top part of the spine. The upper back is the thoracic spine. The lower back, where you've got that curve in your back, that's your lumbar spine. And then your tailbone, way down there, your tailbone, that's your sacral and your sacrum, your sacral spine and your sacrum. So lumbar is down low. So we're going to take a little bit of fluid out of that lumbar spine. And how do we do it? We lie someone down on the side. We numb up the skin. We literally put a little thin needle through the skin into the back and withdraw a little bit of fluid. And we have to use sterile technique. We can't let this get contaminated at all for two reasons. If there's any contamination, then the sample we get is invalid. We can't use it. And we don't want any bacteria from the outside world to go into the spine. So that's called using sterile technique. So we use antiseptics and sterile gloves and sterile and protective gear so that we don't contaminate at all. All right, so any questions about the spine or the CSF? Because we're going to move on to our experiment. So let's say that we have taken Mike to the procedure room. We've taken a little bit of a sample out of his back. We're going to go and take a look at that sample in just a second. Now, before we look at Mike's, take a look at that chart on page 3 of your packet, because we're going to need to fill in that chart as we look at Mike's CSF and analyze it. Now you'll notice that in the chart, there's 3 columns. There's glucose, protein, and white blood cells. All right, the glucose, if it's bacterial meningitis, as we test the CSF, the glucose level should be low. If it's a viral meningitis, that glucose level might be normal. And let's look at the protein column. Again, we're going to test the CSF, and for bacterial meningitis, the protein level might be high. And for viral meningitis, it could be normal or high. And then lastly, the white blood cells. All right, so we've got neutrophils and lymphocytes for bacterial and viral meningitis respectively. And we'll unpack that a little bit more in just a few minutes. So I am going to transition to my laboratory next door. So I'm going to disappear, and hopefully this experiment will go well. Do you all have this equipment too, or am I just doing it myself? Does anybody have this equipment? If you have the equipment, raise your, yeah, all right, great. Unpack your bags. And if you've got your gloves, put them on. And the first thing you're going to want to pull out of your bag is this little sheet that says glucose and protein test sheet. Hopefully you can see that in this view. All right. And you're going to need the test tube that says protein test solution, and the one that says glucose test paper, and then the one that says patient sample. Okay. All right, so get those things handy, and then find your little pipette that matches the protein test, and the little one that matches the CSF patient sample as well. All right. So, got your stuff handy? All right.
Just so you know.
Okay. Thank you. Okay. All right. Here we go. So we're going to take the one that says patient CSF sample, and we're going to put 2 drops just 2 drops. 1. Well, that's only 1. Let's get a second one. 2. Okay, on that glucose. And next, we're going to take our glucose paper, and we're just going to dip it into the All right. Ooh, what happened? What color is that? That's awfully green. Is yours showing up green? And then you probably have a piece of paper with kind of a key on it that shows you. I'll put it in this frame, maybe. Let's put it in this frame. That matches, huh? Can we even see that? Yep. So that's the low glucose. All right, answer number 1, low glucose. I'm going to check it off on my grid. Glucose is low. Okay, shall we do the same with the protein? Oops, wrong thing first. First, I got to do my 2 drops of CSF. 1, 2. And next, 2 drops of this protein solution. This is a pretty yucky green color. Ooh, what happened with yours? What happened? What color did yours turn? Can you put it in the chat? Mine's blue. Yes, blue, great. So blue is high protein. So I'm going to write high on mine. Okay. Excellent, scientists. Thank you for that. Okay, the next thing we're going to do is I'm going to slide this over, and I hope that we can see this. You probably have this card in your packet too. And so take a look at this card. So now what we've done is we've taken some of the CSF and we're looking at the blood cells that are in it, the white blood cells in particular. And there are several kinds of white blood cells on this. So I want to point them out because they're different. Different white blood cells serve different purposes. So the neutrophils, which are these, they have like 3 or 4 different kind of bumpity lobes inside of them. Then you've got monocytes, which are really big and have the big horseshoe shape. The eosinophils are the reddish. And the lymphocyte, there's 2 of them, one here and one here. So which one is most abundant in this view? Which one do we see the most of? Neutrophils. Thank you, Sophia. Absolutely. Okay, so let's put that in our chart. All right, I'm going to transition away from my lab back to here. Okay, so we've got low glucose, high protein, and neutrophils. What kind of meningitis does he have? Go ahead and put it in the chat. Whatever you think he has. He got bacterial. Yes, Celie. Yes, Audrey. Absolutely. Absolutely. He's got bacterial. His pattern matches the bacterial meningitis pattern that we expect. Excellent job, scientists. Very well done. Hurrah. You have diagnosed the patient. Okay, we're halfway through the diagnosis. Now we have to move on and figure out he's got bacterial, but what kind of bacteria? Now, why is that important? Because we need to treat him. And if we don't know what kind of bacteria, there's no way to be really accurate with our treatment. Okay, so here are 3 kinds of bacterial meningitis that you might have heard of. One is called Streptococcus pneumonia, Neisseria meningitis, and Haemophilus influenza. When you were a baby, you got the Haemophilus vaccine. You got, I should remember this, you got it at 2 months, 4 months, and 6 months of age. You got that vaccine. 12 months, 15 months, something like that. So you got the series of Haemophilus influenza vaccinations as babies. And thank God, because you did that, we don't see a lot of Haemophilus meningitis anymore in kids. It was the kind of meningitis that caused the deafness that Dr. Thomas was talking about. So that's great. For those of you who are vaccinated, you're protected. All right, so now we're going to figure out which one Mike has. Okay, you ready? Let's move back to our lab. And I'm going to do a quick change over. Okay, and let me move some of these things out of the way. We need that, we don't need that. Okay, and I'm just getting set up here like any good scientist. I'm trying to keep things a little orderly and organized, but doing the best I can right now. Okay, so here's what we're going to do. We're going to do this coated bead. Now this is, we're going to use the CSF, which you have, and the antibodies. So we need to take a minute and talk about antibodies for a second. All right, let's talk about antibodies before we do the test. I just sort of jumped ahead. Okay, so what are antibodies? Antibodies are what your body makes to identify that bacteria, attach to it, take it out like garbage and get rid of it. That's what the antibody is. And each antibody is really specific to what's called an antigen. The antigen being the appearance of that bacteria or that foreign invader in our body. All right. So your body is creating antibodies all the time, which is fabulous. That's what keeps you healthy. So what we're going to do here is look to see if there's a match between Mike's antibodies and between the antibodies and the antigen, which is the bacteria. Okay, so we are going to put a little bit of antigen, which is his CSF, mix it with a little bit of antibody and see what happens. Ready? Okay, let's give it a try. All right. So here we go. Here's back to the CSF. If you've got yours handy, you're gonna take 2 drops, put 2 drops in each of the circles. Okay. Okay, so we'll start over here with the Haemophilus. And if there is a match, we should see an interesting reaction. Okay, doesn't look like there was much of a reaction there. And that was the Haemophilus, right? So that was the one you got vaccinated with as a baby. I'm not appreciating a reaction there either. Uh-oh, let's hope this works. Let's hope this is the one. And let's see. Ah, interesting. The niceria. What's happening there? What color is yours turning? Mine's getting a little frothy and white. Yes, white, absolutely. Okay, yes, Haemophilus, thank you. Yes, it turned white. Wonderful. Not Haemophilus didn't turn white, the niceria turned white, but yes, Haemophilus is how the other one is spelled. So Neisseria meningitis. Okay, so this is fascinating. And why is this fascinating? Well, how old do you think Mike is? Do we even know from the story? Did they tell us? No. Should we assume Mike is your age? We'll assume he's late high school, 11th grader, 12th grader, something like that. Does that sound about right? Very interesting, because this kind of meningitis, this Neisseria meningitis, is something we actually recognize that's more common in young adults, in teens and young adults, and people who live in communal, some kind of communal living. And so you will get this vaccine before you go to college, because we know there's a little bit of a higher risk for having this kind of meningitis at college because of the close quarters. It's very contagious. So one of the things you will get offered when you are, I think 14 now, we offer it to get kids started on this vaccine so that they're protected before they go away to college. And actually it might be 16. See how soon we forget. But before you go to college, it's important to have this vaccination. Wow, good job, detectives. So you cracked the case. You cracked the case. Yeah. You took a good history, you listened to the symptoms, you examined the patient, you did the testing, and you came up with the diagnosis. And now, what do we have to do? Treat the patient. How are we going to treat this patient? Any ideas? What do you think? What do you think Mike needs? Antibiotics. Antibiotics, absolutely.
No.
And with this kind of, did someone want to say something? With this bacteria, we have to start with IV antibiotics. So it's not just a pill that the doctors give to you from the clinic. This one is a serious one. So it's IV antibiotics. And what do antibiotics do? Well, some antibiotics, most of them work by directly damaging the bacteria. They directly inactivate that bacteria. And so for something as serious as meningitis, that is what we would do, use IV antibiotics. How can we prevent this illness? How do you think we can prevent people from getting this illness? Any idea how? Right, vaccines, exactly. And what does the vaccine do? The vaccine helps your immune system recognize this illness. It recognizes this illness and fight it really fast, right? That's the same thing that the COVID vaccine is doing, right? It is giving your immune system a little advance warning so it can rev up its ability to identify COVID quickly and respond to it. And so that's what vaccines do. Can vaccines cause the illness to happen? If you get a vaccine, can it make you get that illness? So it's a little bit of a trick question, but certainly the general answer is no. No. So some people, when they get a vaccine, might get achy and tired and headachy and feel unwell, but the vaccines don't actually cause you to get that illness. They just cause your immune system to rev up and get to work. And sometimes as your immune system revs up and gets to work, you can feel a little achy and tired and so forth. But that rarely lasts very long. That's a really interesting one. I got the flu after I got the flu shot. I think there are many people who feel that way. And so what I try and share is that the flu shot can't give you the flu, but your immune system might sort of get revved up and you might feel a little achy. But the other thing, though, to keep in mind is that most vaccines are not 100%. They're not 100%. And we're learning that with the COVID vaccine, right? So the COVID vaccine is incredible. Yes, your dad felt tired. I couldn't get out of bed. The second day, after the second shot, I spent a full day in bed. But I got to tell you something. My husband had COVID a year ago, and he spent 2 weeks in bed, coughing and high fever and so forth. So I'll take one day where I can't get out of bed over 2 weeks and a possible hospitalization. But back to, can you get the flu from the flu vaccine? No, but sometimes it just won't work. It doesn't work. And the flu vaccine is different from these bacterial vaccines. The flu vaccine changes every year, and it's based on our best guess of what kind of flu we're gonna see. And sometimes our best guess is a little bit off. You know what that's like. Predicting the future is hard. You are gonna be brilliant health professionals, and you will be called on to predict the future, and it's not easy. It's hard. So flu vaccines sometimes don't get it right. They sometimes don't. Okay, well, we have come to the end of our case. You guys saved Mike's life. You notified his family. Everybody in his family who was exposed got put on antibiotics so that they would be protected and not get sick. You notified public health, because this is the kind of thing that public health wants to know about, so that they can notify the school and anybody else that might have come in contact. And you really saved the day. And as a result, Mike will keep his hearing, his brain will continue to function well the rest of his life, and he can go on and lead a good life because of you. So nicely done, everyone. That's a good question. What if we messed up the diagnosis without knowing? And that's a real question. That sometimes happens, right? And so, you know, sometimes you can mess up in two ways, right? You can do all the right things that sometimes lead you to the wrong conclusion for whatever reason. And you might treat someone in a way, let's say he actually had viral meningitis and we gave him this antibiotic. Well, in that case, it probably would be okay. There are risks to antibiotics. There's risks to hospitalization, but he would have been protected for the worst possible thing. But you can sometimes go the other direction. What if he had bacterial meningitis and we diagnosed viral and we sent him home with some Tylenol and told him to rest and he'd get better in 10 days? That would be a problem. That is why we need smart health professionals, smart clinicians like you all, and really good tests, reliable tests. And as you continue learning about tests, you'll learn that not all tests are created equal. Some are more reliable than others. And we actually have statistical or ways of quantifying how reliable a test is through all sorts of fancy language called sensitivity and specificity. But suffice it to say, people are asking that very excellent question. Do we take responsibility? We always take responsibility for what we do, always. But we know we operate in an imperfect world. And even though we have the best of intentions, sometimes we don't arrive at a place where people have experienced sort of the best of medicine. So we always have to take responsibility because it's an opportunity to learn. It's an opportunity to learn and grow. I mean, think about this. A year ago, when we started talking about the pandemic, way at the beginning, people said, no, we don't need masks, right? Like that was a real thing. The scientists said, we don't think masks are going to help. But as we got more and more information, we learned what? Masks help, right? Masks have made a huge difference. So one thing we know about science is it's always evolving, changing, and we need smart people like you to help science evolve. So that was such a great question about responsibility. What is my experience as a person of color in the medical field? Yeah, that is a great question. My experience is that patients of color really are happy to have providers of color. And so my experience has been very rewarding. And I feel so privileged to be able to take care of people. I mean, it is truly an honor and a service. So is there a specific doctor who diagnoses these kinds of diseases, or like any doctor? Yes. So that is the awesome thing about medicine. If you decide you love, and yes, I am a doctor. If you decide you love things about infection, you can become an infectious disease specialist. So that's like Dr. Fauci. You know, he's an infectious disease specialist. And Dr. Fauci was one of those folks 30 years ago who was really helping us to understand HIV and AIDS. He was so important to our country because of HIV and AIDS. And now he is so important to us again. So if you love infectious disease, this is great. This is the kind of stuff you would be doing. But you can do this also as an emergency room doc. You can do this kind of work as a hospital doc, like Dr. Thomas. Oh gosh, Dr. Thomas, that I'm one of the 8 highest ranking doctors. Oh, that's hilarious. It is, well, I am privileged and thank you. But you can do this kind of stuff as a family physician. And the great thing about being a doctor is you don't have to know what kind of medicine you want to do. You just start and then you'll figure it out along the way. You'll be drawn to something, whether it's the heart or taking care of people with people having babies, or whether it's taking care of folks in the hospital like Dr. Thomas does, or babies. I mean, you will know as you expose yourself to all the options. So is there any extra training or education? Absolutely. So Sophia, do you want to clarify a little bit more about what kind of training or education you mean?
Like, you know how like the usual is like 4 years and then you go on to like more? Like how much more, like how much extra schooling you have to do if you want to become like one of those doctors?
Yeah, okay, excellent. Thank you for clarifying. So medical school is 4 years. For the most part, it's 4 years. And then after that, you can so you do your 4 years of college, 4 years of medical school, and then you go into your training, which is called residency. And that is variable. If you want to be a neurosurgeon and do surgery on the brain and the spine, that's a much longer training. Is it 6 years? Might be 6 years, I'm not sure. If you want to do family medicine or internal medicine, it's usually 3 years. If you want to do something like psychiatry, also usually those are 3 years. Most of them are 3 or 4 years. Some are much longer if you're really specializing. Like if you want to be someone who works in the intensive care unit and taking care of folks with pulmonary problems, that you would do 3 years plus another, 2 years of pulmonary ICU training? Fellowship? Yep. So interestingly, emergency medicine, I think that's 3 years also. So after medical school, you do your 3 years of training. Okay, so here's what I will tell you. Once a person is in medical school, it feels like you have a job. It's not so much like school anymore, because you are doing a lot of your training and your learning in the hospital, side by side with teams and doctors. So it may sound like a lot of school, but really it's all experiential, or a lot of it is experiential learning. And once you're in your training, that is truly like having a job. It's like having a job like no other. It's all very exciting. Oh, that's a good one. Pros and cons of medical school. Yeah. And how do we properly and safely dispose the lab we did today? Okay, that's a good question that I'm not exactly sure, but we're going to figure that out. I don't think that there's anything toxic in our kits. So you probably can put all your vials and your pipelles back into the plastic that you have. I don't think there's anything toxic. So unless you are meant to return it, you probably can throw it away. Let's see.
I can check on that here in the next 8 minutes or so.
Thank you. That would be great. Okay, so the other thing was the pros and cons of medical school. Oh, well, for those of you who love to learn, that's a huge pro to medical school. It's just lots of wonderful learning, and it's learning about you and your own body and how your own body and mind work. And then it really allows you to fill this incredible service and need in our community. And we need more health professionals. You know, we actually have a shortage across our country of health professionals. We do. So we need brilliant young minds to choose medicine. And we need a really diverse workforce within medicine too. We need people coming from all communities who really understand the needs of their communities. And we all get smarter and do better when we have that. So I would say, Ali said, I loved medical school learning. It's true. There's no shortage of sort of awe-inspiring moments, even working with the stinky cadavers. Do you guys know about cadavers? So part of medical school is having the honor of working with someone who donated their body to science, right? So sometimes when people die, they make a gift of their body to science. And it is a privilege to accept that body and to learn from it and work on it. But the downside is those bodies have to be preserved in something called formaldehyde and formalin. And so it makes them, it's a strong smell. And I think some of my books, some of my medical school books still have that smell on them. My dissection book that we used, but it is an incredible privilege. Was internship hard? Oh yeah, it was hard, but it was the good kind of hard, that where you learn a lot about yourself, you learn a lot about people. So it's the good kind of hard. There were some moments where it was the bad kind of hard, but mostly on balance. And by that I mean, you know, sometimes you can't take care of yourself as well as, or at least I found I couldn't take care of myself as well as I'd like to be performing at 100%, right? Not getting all the sleep that I needed. So it was hard, yeah, but good hard. Is the lab
Just so everybody knows, the materials in your kits are benign and they can just be thrown away safely.
Thank you so much. So the lab, we test what a doctor would actually do when diagnosing someone, or do they use machines or other materials? Actually, we would do this. Now, we wouldn't do the lab part. We would send the sample to the lab in the hospital, and the technicians in the lab would actually run the test. But as the doctor, you would be the one to lay the patient down, clean their back, insert that needle, and draw out the spinal fluid. Yeah. So you'd be doing that. And then once you got the test results back, you'd be the one ordering the antibiotics, checking on that patient every day, a couple times a day, collaborating with the nurses who are really taking care of the patient. Would you be surprised if there were robots? That's interesting. That's already happening, right? So there are some surgeries where the surgeons will say that they use robotics for their surgery. Right now, that's just assistance. It's techniques and tools that they use to assist them. But I wouldn't be surprised, no. I think so many incredible things are going to happen in the future. In fact, things that I was talking about that patient who was in the hospital for a week with West Nile virus. That wouldn't happen today. He'd be at home and we'd be able to monitor him from home to make sure he was A-okay. And, you know, so things change really rapidly. I'm actually really excited for the future. And I think the possibilities are endless. But how was the experience of going to school to be a doctor in general? I wouldn't trade it for anything. I wouldn't trade it for anything. It was fantastic. And I think what medical schools are looking for are people who care about people, right? That's the most important thing. Your care, your concern for people, and having that open mind, that growth mindset, wanting to learn. And we all learn in different ways. And I think part of the challenge of medical school is just figuring out how you learn best. Are you someone who learns through doing? Are you someone who has to read a lot before you try? So there's a whole process of getting to know your own learning style. And that's part of the joy and the fun of medical school too. And you make great friends for life in medical school. Okay, all right, I think we're just about at time, and Amanda has put in there, if you could fill out some attendance.
Yeah, it's just an attendance form. And so if you were here yesterday and you've been doing sort of all the stuff this week, it should look really familiar. It's just to tell us who came today, how it was for you, and just a couple of other things for the organizers. We probably have time for one more question.
I really agree with what Dr. Thomas said. Yes. The pressure at medical school is just to do your best and learn and really take great care of people. But it is so rewarding. I can't even tell you. It's so rewarding. Every day we feel like we make a meaningful difference in people's lives. Who gave you the idea of being a doctor? Who inspired you? And how difficult? It is very difficult to get into medical school. It's really challenging. So you want to use your community to support you through that process. And there are lots of folks in this forum and elsewhere who really want to be that community for you. So don't feel like you have to go it alone. Reach out. Who inspired me? Oh man, so many people inspired me. I had a grandfather who was a doctor. He inspired me. I did enjoy science and math as a kid, but I was not, I enjoyed them, but I wouldn't say I was a stellar. I wasn't, out there as a stellar math and science student. I was okay. But really what I loved was taking care of people. But yeah, you definitely gotta stay on top of the science and math. So you guys have been great. Thank you so much for being with us today. I hope this was interesting.